Welcome back, everyone. It seems like you've sent over a ton of material on neurological emergencies this time. Textbook excerpts, chapter summaries, even some presentation slides.
Yeah, it looks like someone's been doing their homework.
It seems like you're really trying to understand how to spot these emergencies, what makes them so serious, and what to do about it.
Absolutely. And these are areas where even a little bit of knowledge can go a really long way. These situations often demand really quick thinking and action.
Totally. And like with a lot of medical stuff, understanding the why can be just as important as knowing what to do.
For sure.
So to dive into all that, our sources start by kind of giving us a little refresher on the brain itself.
Right, the basics.
Yeah. They even call it like the body's computer.
I like that analogy. It's fitting.
And just like a computer, our sources break it down into its key parts: the brainstem, the cerebellum, and the cerebrum.
Each part with its own, important role to play.
So let's start with that brainstem.
Okay, so the brainstem, that's our fundamental operating system,
Hmm.
right? It keeps those automatic functions running that honestly we rarely even think about. Things like breathing, our heart rate, even swallowing.
It's easy to take those for granted until something goes wrong.
Exactly.
Then there's the cerebellum, which I always found really interesting.
What is it about the cerebellum that you find so interesting?
Well, our sources describe it as handling those kind of intricate movements we often take for granted, like standing on one leg or playing a musical instrument.
I see.
It's like our coordination center, making sure everything works together smoothly.
And when something disrupts the cerebellum, we realize just how much we rely on it every second of the day. Suddenly, those simple tasks become incredibly difficult.
It's amazing how much goes on in there that we don't even realize.
Right. So then we have the cerebrum, the big one, the powerhouse, the largest part of the brain.
Divided into two hemispheres.
Yep. And get this, each one controls the opposite side of the body.
The whole left brain, right brain concept. It's fascinating how our sources highlight the cerebrum as being in charge of, well, pretty much everything important. Thought processes, sensations, voluntary movements, even our vision.
A lot rides on this part of the brain, that's for sure.
It really makes you appreciate the complexity.
It does. And speaking of complexity, that's where our body's communication network comes in. The nerves.
The messengers, right?
Exactly. Our sources describe them as the messengers between the brain and the rest of the body, and we've got a lot of them. 12 cranial nerves branching out directly from the brain, mainly to our head and face.
So those are handling things like what? Our eyes, ears, nose?
You got it. Think of them like dedicated lines for our senses, getting priority service.
Makes sense. Got to keep those senses sharp.
Absolutely. And then there are the spinal nerves branching out from the spinal cord, carrying messages to the rest of the body.
So it's like this intricate web.
Exactly. This whole complex, interconnected system of communication pathways, all orchestrated by the brain.
Mind-boggling when you really think about it.
It is pretty amazing. But unfortunately, as we know, things can go wrong with this intricate system, and that's where those neurological emergencies our listener is so keen to understand come into play.
Right. And it seems like our sources want us to focus on three main areas: headaches, strokes, and seizures.
Within those areas, there's a lot to unpack, but it's not about memorizing every single detail. It's more about understanding the events happening within the brain during these emergencies, recognizing those red flags, and knowing when to act fast.
Okay, so let's start with headaches. I think most of us have experienced a headache at some point in our lives.
Probably everyone listening right now.
Right. And our sources do reassure us that most headaches are not life-threatening.
That's good to hear.
They break down a few key types for us. First up, tension headaches.
Tension headaches. Those are usually caused by muscle contractions in our head and neck. They're often linked to stress and feel like a kind of dull ache or a feeling of pressure.
Yeah, I know that feeling. Then there are migraines, which our sources describe as, well, a whole different ballgame.
Oh yeah, migraines can be really debilitating.
They describe the pain as intense throbbing or pulsing, often accompanied by nausea and even vomiting. And get this, they can even be preceded by visual disturbances like flashing lights, almost like a disco party in your head.
Wow, that's a visual. And lastly, we have sinus headaches, which are caused by, that pressure from fluid buildup in the sinus cavities. These often come with those cold-like symptoms.
So with all these different headache types, how do we know when a headache crosses the line from being a nuisance to something more serious?
That's where those critical thinking skills come in. Our sources emphasize that a sudden onset of severe pain, especially if it's described as the worst headache of my life, that should always be a major red flag.
Worst headache of my life. That's pretty specific.
It is. And this is especially important if it's accompanied by other symptoms like fever, a stiff neck, seizures, altered mental status, or if it occurs after any head trauma.
So it's all about paying attention to the context and any other symptoms that are going on.
Exactly. Because, as our sources point out, a hemorrhagic stroke, which is bleeding in the brain, can often present with that type of sudden excruciating headache.
And that's obviously a situation where immediate action is absolutely critical.
Absolutely. Speaking of critical, let's move on to strokes. Our sources define a stroke as an interruption of blood flow to the brain. And what they really emphasize is that brain cells, they begin to die within minutes without that vital oxygen supply.
Time is brain, as I've heard it said.
Exactly. Recognizing those signs and reacting quickly can truly be the difference between life and death.
It's a scary thought. Our sources break down the two main types of stroke, ischemic and hemorrhagic. They say ischemic strokes are far more common,
Much more common.
and that those are caused by blockages, usually a blood clot.
Right, and these clots, they can happen in a couple of ways. A thrombosis is a clot that forms at the site of the blockage, often due to atherosclerosis, which is the buildup of plaque in the arteries.
Okay, so that's one way.
An embolus, on the other hand, that's a clot that actually forms somewhere else in the body, like in the heart, and travels to the brain, creating that blockage.
Oh, wow. So it's like a traveling clot.
Exactly. And our sources point out that people with atrial fibrillation, this is a condition where the heart's upper chambers quiver instead of beating properly. They're more susceptible to these traveling clots, these emboli.
So it really highlights how interconnected our body systems are.
It really does. Now, hemorrhagic strokes, while less common, are often much more severe.
Because with those, a blood vessel in the brain actually ruptures.
That's it. And that leads to bleeding within the brain itself.
Mm-hmm.
Our sources point out that this often happens during exertion, especially for folks with high blood pressure.
So lifestyle choices and managing chronic conditions like that are really key.
They can make a huge difference.
So we've talked about the two different types of stroke, but I know they can manifest in a lot of different ways. But are there some general signs that we should be on the lookout for?
Yeah, our sources provide a pretty long list, but some key things to watch for include facial drooping, especially if it's just on one side of the face, any weakness or numbness, again, often one-sided, loss of coordination or balance, any sudden vision problems, difficulty swallowing or speaking, and of course that sudden severe headache we talked about earlier.
Right, right. And they also mentioned some interesting differences between strokes that affect the left and right hemispheres of the brain. So, for example, with a left hemisphere stroke, someone might experience what's called aphasia.
Aphasia, yeah. That's a communication disorder that affects a person's ability to process and use language.
So does it mean they can't understand what someone is saying?
Not necessarily. Imagine understanding a question perfectly, but struggling to find the right words to answer. It's as if your brain's internal dictionary has been scrambled.
That's a really good way to put it. What about a stroke that affects the right side of the brain?
Well, that can lead to paralysis on the left side of the body, often accompanied by slurred speech.
Yep.
And then there's something called neglect.
Neglect. What does that mean?
So neglect is when the person is actually unaware of the problems that the stroke is causing.
Wait, really?
Yeah, it's pretty wild. Some patients even seem to forget that their left arm or leg even exists. It really highlights how significant an impact a stroke can have on a person's perception and awareness.
That's incredible and honestly a little frightening. But before we jump to seizures, the sources do caution us about conditions that can mimic a stroke.
Right. So hypoglycemia or low blood sugar, that can sometimes present with similar symptoms.
Really, someone with low blood sugar could appear to be having a stroke.
It's possible, yeah. They might even experience hemiparesis, which is that weakness on one side of the body that we often associate with strokes. It just shows how important careful assessment is and considering all the possibilities.
Don't jump to conclusions.
Exactly. Also, that period of confusion and fatigue after a seizure, what we call the postictal state, that can also be mistaken for a stroke sometimes.
Interesting. Anything else?
Finally, any bleeding near the skull, like a subdural or epidural hematoma, that can compress the brain and cause stroke-like symptoms as well.
So again, really careful assessment is key in those situations.
Absolutely. Now, ready to move on to the last of our big three topics, seizures.
All righty, let's do it. What do our sources have to say about seizures?
Well, they start by defining a seizure as a sudden surge of electrical activity in the brain. And this surge, it can show up in a lot of different ways.
Like what?
Well, it can be as dramatic as those convulsions, where you see the severe muscle twitching, or it can be much more subtle, like a brief loss of consciousness or just staring smells.
It's a pretty wide range. I was actually
Yep.
surprised to learn from our sources just how common seizures are. They mentioned that millions of people in the U.S. alone have epilepsy.
It's true, it's much more common than many people realize. And epilepsy, of course, is a very common cause of seizures.
Right. So they talked about seizures being broadly categorized as either generalized or focal. Can you explain what that means?
Sure, generalized seizures, also known as tonic-clonic seizures, are the ones most people picture when they hear the word seizure. Loss of consciousness, the body stiffening, followed by those kind of violent jerking movements.
It's almost as if the body is caught in this, like, chaotic dance of involuntary muscle contractions.
That's a good way to put it. And these seizures, they usually last 1 to 3 minutes. And then afterward comes the postictal state, which that can last for minutes or even hours.
And during that postictal state, is that where someone might experience confusion, fatigue, maybe even some temporary weakness on one side of the body?
You got it. It's all part of that recovery process.
So what about those other types of seizures?
Well, absence seizures are much shorter, only lasting a few seconds. Those involve a brief lapse of consciousness, often with just staring blankly.
And the person recovers quickly, usually with a little to no memory of the event.
Exactly.
And then there are focal seizures, which our sources say start in a specific part of the brain. And those can have a really wide range of presentations.
Yeah, and what I find fascinating about focal seizures is that some people might experience these unusual smells or tastes, almost like a sudden sensory transportation or something.
Wow, that's really interesting.
Right, or they might have involuntary movements, like a twitch in a specific limb, or even experience sudden shifts in their emotions or awareness.
So are there any, like, warning signs for seizures?
Yeah, some people experience what's called an aura before a seizure.
An aura? Like a bad feeling?
Not exactly. Auras can involve things like visual disturbances, unusual sensations, or even emotional changes. And recognizing these auras can be really valuable because it allows people to take steps to prevent injury, like sitting down or moving away from any potential hazards.
Makes sense. So what triggers a seizure? Is it always epilepsy?
Epilepsy is a common cause, but it's definitely not the only one. Seizures can be triggered by structural abnormalities in the brain, things like tumors or scar tissue from previous injuries. Metabolic imbalances like low blood sugar or low sodium, those can trigger seizures too. Then there are febrile seizures. Those are common in young children who are experiencing high fevers.
Right, I've heard of those.
And sometimes, even after a lot of testing, the cause just remains unknown. And that's what we call idiopathic.
So sometimes it's a bit of a mystery.
Exactly. But regardless of the cause, if someone is having a seizure, it's important to recognize it's happening and to pay attention to how it compares to any previous seizures they might have had.
What do you mean? Like, are there certain differences we should be looking for?
Yeah, so any change in their behavior or the way the seizure presents itself, like
Yeah.
how long it lasts, the types of movements they make, or any complications, such as if they get injured or if they're having trouble breathing.
It's all about those details.
Exactly. It's also important to know that all of that intense muscle activity during a seizure, that can deplete oxygen levels in the body.
Oh, wow. Really?
Yeah. And that can lead to a buildup of acid in the bloodstream. That's actually why someone might turn a bit blue during a seizure.
I didn't realize that. That's really interesting.
It's called cyanosis. And another thing to keep in mind, for individuals with diabetes, it's really essential to monitor their blood sugar after a seizure because they may experience a drop in blood sugar.
So much to keep in mind. It's a lot of information.
It is.
But I think we've covered a lot of ground already. We've gone from the different parts of the brain to those three major categories of neurological emergencies. Where do we go from here?
Well, we've laid a strong foundation, but there's still so much more to explore. Next, I think we need to dive into altered mental status, which is another fascinating and often complex area.
Altered mental status, it kind of seems like a pretty broad term. What does it actually mean?
You're right. It is a bit of a catch-all term. Our sources describe it as any change in a person's normal thinking process. Basically, how clear and aware are they? And it can range from something as mild as just being a little confused to being totally unresponsive, like being in a coma.
So it's not a condition in itself, but more like a sign that something else is going on.
Exactly. It's a symptom, not the disease itself. Think of it like that warning light on your car's dashboard.
Okay, I like that analogy.
It tells you something's wrong, but it doesn't tell you what's wrong. You're going to need to investigate further to find the root cause.
That's a really helpful way to think about it. And based on what I'm seeing in these sources, there's quite a few potential culprits behind that flashing warning light, as you
Yeah.
called it. Everything from like low blood sugar to serious infections.
Yeah, it's a pretty wide range. Our sources specifically list things like hypoglycemia, hypoxia, intoxication, delirium, drug overdose, head injury, brain infections. And that's not even an exhaustive list. It's amazing how something as seemingly simple as low blood sugar, or hypoglycemia as it's called in the medical world, how that can actually mimic a stroke.
Wait, really?
Yeah.
Someone with low blood sugar could seem like they're having a stroke.
It's possible, yeah. They may even experience hemiparesis, which is that weakness on one side of the body that we often associate with strokes. It really drives home the point that we have to assess carefully and consider all the possibilities.
Don't jump to conclusions.
Never jump to conclusions. Our sources also spend some time talking about delirium, which is that temporary state of confusion. It often stems from some kind of physical or mental cause.
And delirium usually involves a pretty sudden change in someone's behavior, right? It's not like a long-term thing.
Right, it's usually a sudden change. And our sources mention that it can be brought on by things like infections, changes in medication, or even just a lack of oxygen to the brain, which is also called hypoxia.
The symptoms they describe sound pretty intense: disorientation, jumbled thoughts, memory problems, even hallucinations or delusions. That could easily be mistaken for intoxication or, even a psychological issue.
Exactly. And it just highlights how crucial it is to do a thorough assessment, especially with older patients who might be more prone to delirium. But again, our sources are very careful to say, don't rule out other possibilities just because someone is older and experiencing delirium. They might have an undiagnosed head injury, or they might be intoxicated with alcohol. There's a lot of potential causes.
Right, and they make a really good point about not assuming that someone is just drunk. They might have a hidden medical condition that's actually causing those intoxication-like symptoms.
It's like you said earlier, we've got to look beyond the surface. Because chronic alcohol use on its own can really do a number on the body. It increases the risk of things like liver problems, blood clotting issues, even makes someone more susceptible to brain infections or bleeding.
It all ties together in the end.
It really does.
And of course, our sources remind us that things like psychological conditions, complications from medications, and infections can also lead to an altered mental status.
It's a long list of potential causes.
It is. There's a lot to consider.
There is. It shows just how complex these neurological emergencies can be. And that's why, we need a really systematic approach to assessment. But let's maybe shift gears a little bit here and talk about what you can actually do during these situations. Our sources offer some really helpful guidance on emergency care.
Okay, so what's step one? What do we do?
Well, they start with some general principles that apply across the board for any neurological emergency. Safety always comes first. Always, always, always.
Of course, makes sense.
They emphasize taking standard precautions like wearing gloves if you have them, calling for additional resources early, especially if you think you might need advanced life support, and rapidly assessing the patient's level of consciousness and their ABCs.
Right, the ABCs.
Yeah.
Airway, breathing, circulation.
You got it. And our sources, they really stress how critical those ABCs are because things can change so quickly with these types of conditions.
What kind of changes are we talking about?
Well, with a stroke, for example, it can affect the body's ability to maintain a clear airway or breathe effectively. It can even mess with the heart rhythm. Seizures, those can obviously lead to falls and injuries or cause breathing difficulties. And then altered mental status, no matter what the cause is, can prevent someone from protecting their own airway. So it's a big deal.
Wow, that's a lot to keep in mind. So let's break it down a bit, maybe by condition. For a stroke, it seems like getting the person to the right medical facility as quickly as possible is really the most important thing.
You are absolutely right. Our sources really hammer home that rapid transport to a designated stroke center is super important. Like we've said, time is brain. The sooner someone can get that specialized care, the better their chances of minimizing any brain damage. And while you're on the way to the hospital, you want to support the patient's ABCs, give them oxygen if you have it and it's needed, and try to protect any paralyzed limbs from further injury.
Okay, that makes sense. What about during a seizure? What's priority number one?
Our sources emphasize protecting the person from harm during the seizure, especially if they're having those really intense convulsions. Clear the area around them, move any objects that could cause injury, try to position something soft under their head if you can, a jacket, a blanket, anything like that.
And I remember reading something about never putting anything in the mouth of someone having a seizure.
Oh, yeah, that's a myth that people can swallow their tongue during a seizure. It's totally not true. And sticking something in their mouth can actually cause a lot more harm than good. You could break their teeth or injure their jaw. It's not worth the risk.
So what should we do instead?
Focus on just keeping their airway open once the seizure is over. You can gently tilt their head back and lift their chin if you need to. And be prepared to provide rescue breaths if it seems like they're not breathing well on their own.
Okay, good to know. And how about for someone with an altered mental status? It seems a little trickier because you might not know the cause right away.
You are absolutely right. It often does take a little bit of detective work. Our sources stress staying calm and assessing the situation systematically. So, first things first, just like we've been talking about, check those ABCs, make sure their airway is clear, that they're breathing, and that they have a pulse. Then you can start trying to figure out what might have caused this change in their mental state.
So are there any clues we should be looking for in particular?
Yeah, look around. See if there are any signs of a potential cause, like maybe a head injury, any medication bottles lying around, a medical alert bracelet or necklace, anything in the environment that might give you some kind of clue.
So observation is key.
Observation is key. Also, try to figure out if the change in their mental status was sudden or more gradual, and if they've experienced anything like this before. The more information you can gather, the better equipped you'll be to help them.
This is all such useful information, but I can also see how it'd be easy to feel overwhelmed if you were in that situation. So for our listener, what's the absolute most crucial thing to remember about neurological emergencies?
I think the biggest takeaway here is that time is really of the essence. These conditions often require very quick action. Recognizing those warning signs and knowing how to respond effectively can make a world of difference.
It's empowering, in a way, to have this knowledge. Like, our sources are giving us the tools to be more aware and proactive if we ever encounter these situations, rather than just feeling totally helpless.
I love that. That's exactly it. But we're not quite finished yet. There's one more crucial point our sources emphasize, and it has to do with safety during a seizure.
Hmm.
Specifically, they want you to think about potential hazards in a home.
Hazards in the home. Okay, now I'm really curious. What are our sources talking about here?
So picture this, a really common, everyday object, something you'd find in almost any house. Seems harmless enough, right? But it could actually be incredibly risky for someone who's having a seizure.
Okay, let me think. We talked about how dangerous falls can be during a seizure, so I'm guessing it's something that could either cause a fall or maybe lead to an injury during those convulsions.
You're on the right track. What about the bathtub?
The bathtub. Oh my gosh, you're totally right. I didn't even think about that. If someone were to have a seizure while they're taking a bath, they could drown.
Exactly. It's easy to overlook those everyday things, but this really highlights how even something as simple as a bath can become dangerous during a seizure.
Hmm.
So if you're caring for someone who has a seizure disorder, you really have to be extra careful about their surroundings, their environment.
So what can people do to actually make their homes safer, more seizure-proof?
Well, our sources have a few practical recommendations. First, whenever possible, see if you can swap out baths for showers.
So just avoid baths altogether if you can.
Exactly. If a bath is unavoidable, for whatever reason, never ever leave the person alone in the bathroom. And you might even consider using a shower chair to reduce the risk of slipping.
Good idea.
And then outside of the bathroom, just make sure that pathways are clear, that there's no clutter in the way. Secure any loose rugs, and think about padding sharp corners on furniture, especially if the person tends to have seizures at night.
All really good tips. It sounds like it's all about thinking ahead, anticipating those potential dangers.
Absolutely. And even with taking all the precautions in the world, accidents can still happen. Nobody's perfect. So knowing what to do when a seizure happens is just as important as trying to prevent those injuries in the first place.
Right. We don't want to forget that first aid piece.
Exactly. So it's worth repeating. Stay calm, protect the person from getting injured during the seizure, make sure to keep their airway clear once the seizure is over, and just watch them really carefully for any signs that they're having trouble breathing or any other kind of complications.
And never hesitate to call for help if you need it.
Never. It's always better to be safe than sorry.
I couldn't agree more. Wow, this has been an incredible deep dive. I feel like I've learned so much, not just about the brain itself, but about all of these urgent neurological conditions. But even more than that, I feel a lot more prepared, more confident that I could actually do something to help if I ever needed to.
And that's what it's all about. It's about turning that knowledge into action. We've really covered a lot today, from how the brain works to the signs and symptoms of these emergencies to how to provide that initial care.
It's been quite a journey, and it's all thanks to these amazing sources you shared with us. It's really incredible how much we can learn in such a short amount of time when we do a deep dive like this.
Knowledge is power, my friend, especially when it comes to our health and well-being.
Couldn't have said it better myself. I think our listeners leaving today feeling a lot more prepared, a lot more informed about how to handle these situations should they ever arise, thanks to these incredible insights we've uncovered together. So until next time, everyone, stay curious and take good care of those amazing brains.